Chronic muscle pain, a lot of us have it, and with us this morning is a man who's going to help us cope with it. Dr. Paul Davidson is here this morning. He's a rheumatologist and practices in California, and the author of a book called Chronic Muscle Pain Syndrome. And the subtitle is Understanding and Treating Fibrositis. What does that mean?
Well, fibrositis is a chronic muscle pain syndrome.
That's just a scientific word for, that hurts.
It means that muscles ache. The fibrositis is a disorder that's been known for at least 150 years in the medical literature, and why people haven't written about it more, I don't know, but it's just now becoming much more apparent to the public and to the medical profession, as a matter of fact. But basically, it's a chronic muscle pain disorder in the muscles primarily of the neck, the upper shoulder. It can involve the back and the hips, and it's persistent. It's not like the aches and pains you get when you exercise, which go away. But these can go on for weeks and months and even years.
What causes this to develop?
Well, over the past 150 years, we've never found one positive finding. No x-rays have been positive, no laboratory studies, no tissue biopsies. Everything has been perfectly normal, and that's what's been the puzzle. Now, if you follow people and you read the literature and you see what's going on for the past 150 years, you realize that this is primarily a stress-related disorder.
Is it related in any way to rheumatism? Must be.
Well, it is. Rheumatism is a catch-all term for all the aches and pains we have, whether it be arthritis or soft tissue rheumatism. This is what's called soft tissue rheumatism. There's no arthritis involved in here, although it may occur with arthritis.
What would set this apart then from, you know, the pain that people get in their shoulders from stress, or chronic pain in that way, or you get little knots and popcorn back there, or pains that you might get just from something like poor posture? Well,
really nothing, except that these are chronic. The others will go away with maybe a little exercise. Maybe they come on periodically, but these don't. These are very severe pains to the point that some people are disabled. They can't sleep. It's often associated with headaches, irritable bowel syndrome, temporomandibular joint pain, and it's often been confused with a chronic fatigue syndrome. In fact, most of the people who think they have the chronic fatigue syndrome actually have fibrositis. Some recent studies have shown that.
Well, how is this treated then?
Well, it's treated basically based on its cause. And I devised a program that I call Retrain, which basically retrains your body, retrains your mind, and helps you to deal with this and to cope with this, because medications have been found to be very ineffective, except for one, amitriptyline, but aspirin, acetaminophen, non-steroidal inflammatory drugs, even cortisone doesn't help this disorder.
So would it feel like the kind of muscle pain you have if you, say, overuse a muscle? I have one right here on my side from working on an exercise machine, and I obviously pulled a little something, and I know that's going to go away.
That's right, but these are generalized.
Does it feel the same way?
In essence, yes. These are generalized, though, and many people describe it as like having the flu. They say, I just ache all over. Their muscles are tender. The only positive finding is subjective muscle tenderness. When the physician presses, for example, their patient goes, oh, that hurts. And you don't have to press very hard. It's an interesting disorder. It affects mainly... Oh, go ahead.
And I'm just going to say Retrain is an acronym.
Right, it is an acronym.
For a seven-part program.
Rest and relaxation, education, which is very important, therapeutic muscle training, responding to stress, analgesics, amitriptyline, injections. I don't use them very often, only when there's associated tendinitis. And N is never give up hope. You really can do something. If you read the literature 10 years ago, everyone said this was an untreatable disorder. Really, 10 years ago.
You started to say something before. You were saying it affects mainly who?
Affects mainly women. The interesting feature of this disorder is that and again, it's been known for 150 years, it affects primarily women between the ages of 20 and 50. Now, it's been found in children and in elderly people and in men. I have a lot of men in my practice with this. But it's mainly women between the ages of 20 and 40 and 50, and they go from doctor to doctor, and the doctor just can't find anything because there is nothing to find. And he said, well, gee, I don't know what this is. You know, you can take a couple aspirin, maybe that will help, or it may be a little arthritis, or some women even have numbness and tingling. It's been diagnosed as multiple sclerosis. It's had so many diagnoses because there's nothing to find, and the doctor is in a bind, and the patient is in a bind, unless they're familiar with this disorder.
What is your theory on why women would primarily be affected by this?
Well, that's a good question. My theory is that first of all, they have a smaller muscle mass. I think they're more apt to get this localized tension problem. And then there are obvious hormonal changes and hormonal differences between men. And I think that the stresses that women are under are quite different. I think they've always had quite different stresses than men, and they're having them again now because of the fact that they're becoming more aggressive and in business and various other situations. And I think all this feeds into it. I might add one thing, that the name of this, fibrositis, is probably a misnomer. It should be called fibromyalgia. It was given the name of fibrositis in 1904, but I use that name because it's historically correct. But it's been called fibromyalgia, myofascial pain syndrome, soft tissue rheumatism, 100 names.
Itis means really inflammation, right?
And there is none. That's correct.
No.
That's correct.
Okay, we'll take a break here and give our phone number, 578-1000. Dr. Paul Davidson is here this morning. He holds a clinical appointment and has for a couple of decades at the University of California Medical School, and we'll be back with him to take your questions on chronic muscle pain in a minute.
Peter, can we really fly?
Just think wonderful thoughts. Summer, Christmas, we're flying!
And far out of sight, second star to the right. Wendy, Michael, John, Tinkerbell, come on! Hurry up and follow me, or soon I will be gone.
Tickets available at the Playhouse Square Center box office. All Ticketrons are charged by phone at 241-6000.
Look what's here. It's the big Woolworth Buyer Sale, packed with lots of great buys for your home and family. Like this Light and Easy iron by Black & Decker, priced to just $10.99. 50% off all lampshades in stock, and 50% off selected lamps. You'll also find lively Hearts parakeets at just $9.99. And this parakeet cage with care kit for just $17.99. All this week at the big Woolworth Buyer Sale. Bring your friends.
Pick a pair, pick a pair. Pick a pair at Rent-A-Center.
It's Rent-A-Center's Pick a Pair sale, where this TV and VCR pair is just $16.99 a week.
Pick a pair, pick a pair.
This washer-dryer pair is just $16.99 a week. Even this sofa set is $16.99 a week. There's lots to choose from, so don't miss Rent-A-Center's Pick a Pair sale. Pick 2 brand-name products, pay 1 low price.
Pick a pair, pick a pair. Pick a pair at Rent-A-Center. It's Velveeta versus cheddar. Our Velveeta melts much better. Cheddar's lumpy, cheddar's oily. It dribbles off your plate onto your doily. See, Velveeta melts so creamy. It improves your tetrazzini. When the cookbook calls for cheddar, make it with Velveeta, it cooks better.
Melanie Griffith and Jeff Daniels. From mild to something wild.
Friday at 11:30 on TV5.
Dr. Paul Davidson is here this morning. He's a rheumatologist. He practices in California, and he's written a book called Chronic Muscle Pain Syndrome. You think you might have it?
Very possibly, yeah. It might explain this. I have a lot of chronic shoulder pain. Shoulder and neck, you know, and sometimes it's nearly debilitating and I can't move my head around very well. It makes it hard to look at the guests.
We'll have to get this program here. It's called Retrain. We'll take all elements and apply them to you.
All right.
All right, let's take some calls here. 578-1000 is our number. Call us collect at 578-0550 if you're out of our immediate area. Good morning. Your question, please.
Hello, doctor. I was wondering if any of your patients have gotten any comfort from a TENS unit as opposed to any drugs.
Well, I've been a little disappointed in the TENS unit. The TENS unit, for those that don't know, is a transcutaneous nerve stimulator. It's a little electrical gadget. It's run by battery. It's quite safe. But that has helped some people, but I find the other elements are much, much better. That's a very passive type of pain relief. You have to be more active to really get relief from fibrositis.
Hello, your question.
Yes, I'm 23 years old. I've had these pains for about 10 years now, and 3 years ago I was diagnosed as having fibrositis. My doctor told me that the best thing I could do is exercise, lightweight, a lot of repetition.
Okay.
But I'd like your opinion on that, please.
I couldn't agree with him more. I think that exercise is very good, stretching is good, stress relief is good, and education and knowing what fibrositis is about. And there are a lot of other elements, too, that can be used, but I think your doctor's on the right track.
And your question, hi.
Yes, I wonder if you could tell me what the relationship between allergy and rheumatoid arthritis is.
Allergy?
Well, that's a totally different thing. Rheumatoid arthritis is an arthritis, and this is not an arthritis. And the link between allergy and rheumatoid arthritis is very weak, but it's not related to this.
And your question?
Yeah, talking about women between the age range of 20 and 50, I talk with clerical workers a lot, and we're finding that women that tend to do a lot of work, like customer service work, things where they're bound to their desk, where they're monitored by the computer and randomly monitored, which causes a lot of stress and strain, seem to suffer these syndromes. And it would be nice if the medical community did more education on what monitoring and what these types of jobs where you're immobile for 8 hours a day, what kind of damage it does, so workers' comp would start recognizing these types of claims.
All right, what do you think of that?
Well, that's part of the problem. Now you're getting into a whole new ball game here. You're right. Many people who work like that do complain of these problems, and that's known as localized fibrositis or repetitive strain syndrome or occupational cervicobrachial syndrome. I discuss that in the book. It has a lot of meanings, but it is not an injury. It is not an injury. It's more of a muscle tension problem, and it's often related to what goes on outside the work and inside the work, and sometimes some stretching exercises will get rid of the problem.
And your question?
Yes, doctor, could you tell me, I've been having this for about 3 years and was tested for arthritis with blood work and things and never really diagnosed as having it. I also thought it was chronic fatigue syndrome and found out that I didn't really fit into all of those categories either. My mother has the same thing. I'm about 32 years old, and I was wondering if this is hereditary in any way, and also could you please tell us a little bit about the drug that you said that does work? I take between 6 and 9 acetaminophen tablets a day to try to make it through. Thank you.
Well, 2 parts of the question. The first, is it hereditary? Is it a nature versus nurture, or is it environmental? I think it's probably a combination of both, because a certain personality tends to develop this problem, and personalities are partly genetic and hereditary. And so I think there are 2 things that are involved. Yes?
And the second part of the
The second part is the drug. Amitriptyline is the drug. It is a tricyclic antidepressant, and it's used in much smaller doses that we use to treat depression. It is a prescription drug, and if you have fibrositis, it may be helpful if nothing else works. I like to try all the other features before I go to medicine, but amitriptyline has been used very often in this disorder.
Can diet affect this
No.
in any way?
I really don't think so. I don't think the diet has anything to do with it, because most of the people I see with this are usually very well read, very well nourished, and have good diets.
Hello, your question.
Yes, I'd like to know if I have this fibrositis, or if I have a muscle spasm. I went to the chiropractor. He said it was muscle spasms due to tearing my back up so bad. I haven't been able to build it back up.
You had an accident?
Yes and no. I had lower back pain, and then a couple times it got triggered where I couldn't even walk, like, for several days. And at one point, it got so bad I was off from work 2 weeks, and I went to a chiropractor. He said he couldn't find nothing wrong, but the muscles were swelling way in the lower part of the back.
Okay.
Well, that may be part of it. Sometimes you can get back pain from this problem that is just localized. Usually that's more of a localized problem, and sometimes it can be even a disc. And I would suggest that you see your physician again, get re-examined, because it may not be fibrositis. It may be related, but I think it may be something else.
And I think we have time for another one. Good morning.
Yeah, my question is if you use spray and stretch as part of your treatment, and also if you do, how do you stretch the subscapularis? I'm a therapist, and I have difficulty stretching that particular muscle. Thank you.
Which muscle is that?
Under the scapula, subscapularis, under the shoulder blade. Well, do I use spray and stretch? Well, that is a technique used by Dr. Janet Travel, and she sprays with fluoromethane and then stretches the muscle. I don't use that very often. I think that may be helpful. I'm more for active type of exercises. I like to say to the patient, look, have the physical therapist train the patient, say, I'm not going to do it. you're going to do it. Here's what you have to do. Here's your postural exercises, aerobic exercises, stretching exercises, but you're the one that's going to have to do it. But it's a good question. Good point.
Janet Travel was President Kennedy's personal physician.
Yes, she was. She used to massage his back.
And she's still active, or?
Yes, yeah. She's written a book that's about that thick, that gives all these myofascial pain points. Not everybody accepts them, however, but some people do.
Well, Doctor, your book is not that thick, but it's thick enough. It's enough to tell you everything you need to know about chronic muscle pain syndrome. And Dr. Paul Davidson has written this out of his 30 years or so of being a physician. Is that about right?
That's right.
That's about right. He's now a clinical professor at the University of California Medical School and a rheumatologist who's been trying to understand fibrositis, that kind of pain that makes you feel like you're just sore all the time.
Yeah.
And we've tried to help you a little bit to get a handle on it, maybe do something about it. Thank you, Doctor, and good to have you here.
No, it's my pleasure. Thank you.
And when we come back, we're going to be doing a little potty training right here before your very eyes. And Susan Biasella will be here for that purpose. We're also going to check in and see how the weather is today. And here's Dan.
When you go to the store, pass the Pelicans and head straight for 100% pure Florida grapefruit juice.